I will try. So, as we mentioned in the previous session, those are the ABO group, and we mentioned that the antigen is present on the red blood cells, and the antibody is present in the plasma. So, the effect of incompatible blood transfusion in this case, it involved the recipient plasma antibodies and the donor red blood cells. So, a group recipient, if we are giving different groups, in this case, the antibodies which is present in the recipient plasma, it will attack the antigen on, or it will attack the blood cells of the blood donor, and it will lead to hemolysis of the blood agglutination and hemolysis. This is the slide that we mentioned in the last session. So, blood type A can receive from A and O. If it is positive, it will receive from positive and negative. If it is negative, it will receive only from negative. Blood B can receive from B and O. If it is negative, can receive from A, negative, and if it is negative, it can receive from negative. If it is positive, it can receive from negative and positive. If it is positive, it can receive from negative and positive. So the blood AB, it can receive from all blood group. If it is positive, it will receive from all categories. So it is what we call it universal recipient. And the blood group O negative, it can be a universal donor. It can donate to all type of blood. So this is the regarding the blood group and how we can donate blood to other, and how we can fuse the blood type. So hemolytic reaction occur between recipient plasma, the patient plasma, and the antibodies which is there in the plasma, and the donor blood, the blood that we are transfused to them, the blood that transferred from other person to that patient. So when we are transferring different type of blood, the plasma of our patient blood, it will react against the blood cells, and it will lead to hemolysis and agglutination. In this case, we call it the incompatible blood, and the action is expected. So A can receive from A, it cannot receive from B. Reaction will occur. If AB also AB can receive from A, can receive from B, can receive from AB. So it depends upon the antibodies which is there in the body. So did you understand the universal donor and universal recipient? Universal donor, the donor that his blood is not containing the antigen, which is O. There is no antigen A or B. The universal recipient, the AB, which is containing both antigen. So it can receive from others because there is no antibody in the plasma. So there will be no reaction. The reaction, it will be from the plasma of the recipient. So the plasma of the recipient, because does have the antibody, it will attack the blood cell which is transferred to them if it is different type. Did you understand what we talk about? إذن المستقبل لازم تكون الدم اللي معطى له بنفس ما في اللي هي الانتيجين اللي الانتي بادي موجود في البلازما ماله، فلازم يكون متوافق معه. طيب. Then we said that there is the blood group RH either negative or positive. So the RH, it is antigen. The RH antigen are another important antigen called the rhesus antigen because it was identified first in rhesus monkeys. Rhesus monkeys is a type of monkeys that it has the same antigen. People who have the RH antigen on their RBC are called RH positive. So those without RH or rhesus factor, they are called RH negative. So the anti-RH antibody are not present in the plasma of those persons if they are having positive. So if antigen is there in the cell, again it is the same as the blood group. There is no antibody in the plasma. If no antigen in the cell, in this case, antibody will be there in the plasma. I saw some exhibition which mean sometimes to me that you are not understanding what is I am talking about. Are you understanding what I am talking about? Don't feel shy. I can repeat. In every body blood cells, every one of you is having different type of blood. That red blood cells is the thing that will make the difference is the antigen which is present in your red blood cells. So for the blood group, there are two antigens, either A or B. It is on the blood cell. If the red blood cells contain antigen A in the plasma, there will be no antigen A. Because if antigen A is there in the plasma, it will attack the blood cell and it will be hemolytic. Okay, great. But there is antibody B. So if your blood is A, it means that antigen A is there in the red blood cell, and antibody B is there in your plasma. If your blood is B, it means that your red blood cells is having antigen B, and your plasma is having antibody A. If you are AB, it means that your red blood cell have antigen A, antigen B. Your plasma is free from antibody. So no antibody is there. Because of that, when you receive any type of blood, there is no antibody in your plasma. So it will not attack the blood that you are taking from outside. Did you understand it now?
Yes.
The second thing is the rhesus factor. So the rhesus factor, it is either present or not present. If rhesus factor is present, it is called positive. So the blood group which contain RH, it is called positive blood group. So those positive blood group the red blood cell is having the rhesus antigen. Their plasma, it doesn't have antibody for rhesus factor. The other who did not have the rhesus factor or the rhesus antigen in their blood cell, the antibody, it will be there in their plasma. So if they are receiving even the same group of blood, but if it is positive, the rhesus factor is there, the rhesus antigen is there, their body will develop a reaction because their plasma is having antibody against rhesus factor that will attack the red blood cells, and it consider it as a foreign body. Is it clear now? Okay. So, as we said, people who have Rh antigen, their RBC are called Rh positive. Those who without Rh antigen, their RBC is Rh negative. The anti-Rh antibodies are not present in the plasma of Rh person. But if Rh negative person receive mistransfusion with Rh positive, the blood immune system gets sensitive and begin producing antibody. So the antibody here, it is not there unless you are exposed to blood from Rh positive. So the rhesus factor, the difference between rhesus factor and that, the possibility of antigen, it might be there if you are exposed to Rh positive group, but normally there is no antigen. Hemolysis does not occur with the first transfusion. Why? Because the antibody is not still there. Because intake one time make the antibodies of Rh positive antibody and not found already in the plasma like the antibody of A and B. So this is the difference between. So the second subsequent transfusion or exposure to Rh positive involves the antibody attack the donor Rh leading to hemolysis. So receiving role in this case, Rh positive person can receive from both Rh positive and negative. The Rh positive can receive from positive and negative. Universal recipient, the A, B positive, they can receive from all. The Rh negative person can receive blood from only Rh negative, but not from Rh positive. If they are receiving from Rh positive, then they will develop antibodies. Their body will develop antibodies. Donation role here, Rh positive person can donate to Rh positive person. Rh negative person can donate to both Rh negative and Rh positive. متبرع بتبرع إذا كان Rh negative بتبرع للجهتين للبوزيتيف وللنيجاتيف. المتبرع إذا كان بوزيتيف بتبرع بس للبوزيتيف. So the O negative is universal donor can give to all. نسميه معطي عام. The Rh related problem during pregnancy. Did you hear about problems of pregnancy and jaundice أو الأبصفار بتسموه أنتوا شيء بتسموه ولا في أبصفار ثاني؟ طيب. For the jaundice or the yellowish discoloration, there are two types of yellowish discoloration. Either what we call it the physiological jaundice and the jaundice which is due to the Rh sometime or to hemolytic jaundice. We call it the hemolytic jaundice. طيب. الآن there are premarital test which is done. From the premarital test, it is the blood group. So now I want to ask you a question. If the female is having a blood group Rh positive, is there any problem if she gets married from a male who is having Rh negative or Rh positive?
No.
Is there any fear in relation to?
No.
He said no. Who is agreeing with him? Are you agree with him?
Yes.
Yes. So he is right. Thank you. Why? So
Alright.
if you are having Rh positive, there is no issue. نام وانت مستريح. You will not have any problem related to Rh incompatibility in this case with it. But the problem, if the female is having Rh negative. In this case, if her husband is having Rh positive, here there are two possibilities that the infant or the embryo can be Rh positive or Rh negative. So, if she get pregnant and the Rh of the embryo is positive, she is negative, and the embryo or the infant, embryo while he is in the uterus, when he come out, he will become an infant. So, if the Rh is positive for her child, in this case, during delivery, you know that the placenta is attached to the uterus, to the uterine wall. It will be separated from the uterine wall. During pregnancy, there is no mixing between the blood of the mother and the embryo. So there is a barrier. The central barrier will be there. There are transmission of or exchange of nutrient and gases and waste product between the placenta and the blood or the blood of the embryo and the blood of the mother, but there will be no direct contact between the blood of the embryo and the mother. But during delivery, the placenta will slough from the wall of the uterus. When it is sloughed from the wall of the uterus, the sloughing itself means that some time of the placenta it might bleed from the side of, and the placenta is containing the blood of the embryo of the child. So those drops of blood which is coming out from the placenta inside the uterus, and the uterus there are some injury due to sloughing of the placenta from the wall of the uterus. So some drops of blood, it might go with the blood of the mother. So if the Rh is positive for the embryo, what will happen? Her body does not have that antigen. So it will be considered as antigen for her. So her body will start, her immune system will start to develop anti-Rh, anti-D. So anti-D will start to be developed there. So the first one, he will pass without any problem, because still the mother is not having the antibody in her blood. But the problem it will come for the next pregnancy. If the second child also his blood is Rh is positive, in this case, we know that the antibodies can be transmitted from mother blood to the embryo. Because of that, it will give the immunity to the child after birth. So those antibodies, when it's transmitted through the placenta to the new embryo, it will lead to destruction of his blood cells. It will lead to agglutination and hemolysis of his blood cell. By that, it depends upon the level of the antibodies. If the level of antibodies is high, in this case, it might be fatal and it might lead to intrauterine death. If it is low, he might pass with jaundice. And jaundice also, it might lead to other problems like brain problems and others. Because of that, if it is happened and a lady or a girl is getting married from her husband, and her husband is Rh positive and she is Rh negative. In this case, immediately after delivery, she should get anti-D. بيعطوها مباشرة بعد الولادة الانتي-D, ابرة anti-D. The anti-D, it is antibodies. So it will attack the cells of the red blood cells of the embryo when that pass to the hair circulation, and it will not permit her immune system to produce antibodies. يعني if you are having the antibodies ready, if the antibody is ready in your body, in this case, it will fight without stimulating the production of new antibodies. But if antibodies is not there, your immune system, it will be stimulated and it will produce a high amount of antibodies and it will attack the child. Did you understand this point? Yes. This point also, you will come along with it in pediatric and maternity later also. So this will lead to what we call it the hemolytic disease of newborn. Hemolytic disease of newborn. Hemolytic, it is hemolysis of the blood. Yani the blood, it will be distracted. The blood cells, it will be distracted. Now, we will come to the blood typing. So the blood typing, we can know the blood type. We can know it by using the antibodies, taking a specimen from drop of blood, 3 drops of blood from the person, and putting on that drop, each drop, a drop from those solution. This is anti-A, anti-B, and anti-D. So this is anti-A, and this is anti-B, and this is the anti-D. So if we put the anti-A and it become agglutinated, in this case, it means that the group is A. If it is agglutinated with anti-B, in this case, it is group B. If it is agglutinated with D, in this case, it is positive. If it's not agglutinated with D, it is negative. So this is how we are dealing with the blood group. So if we put anti-A and it got agglutination, so it is A. If it doesn't, it is in this, and it agglutinate on B, so it is B. If agglutinate in B, A and B, it is AB. If it agglutinate with A and B and D, in this case it is AB positive. The O it will not agglutinate. So this is A, B, this is B, this is A, this is O, because no agglutination is there. Right. The cross-matching, as I told you before, that cross-matching involves testing agglutination of donor red blood cell and recipient serum of plasma to determine if recipient plasma has any anti-others antigen on the red blood cell. Recipient RBCs and donors serum of plasma determine if the donor plasma has any ABS antigen recipient or in this case sometime major or minor antigen. So in this case if there is agglutination happened, it is the cross-matching. The cross-matching in this case we cannot give antibody. If there is no agglutination, then in this case we can give the. Thank you. I will show you